on the one hand, what is it and how do people get it? Okay. And then the second thing is how does the existence of some fibromyalgia affect a patient or a patient's response to trauma or future injury?
Sure. Fibromyalgia is in vogue now. I remember when I was in training, when the first term of fibromyalgia was coming out, I was a Mass General. And one of the neurologists that was very smart was the first time I ever heard this term of fibromyalgia came through him. And I remember asking him, what is that? And he says, well, that's a muscle problem in which patients develop trigger points all over the body and it hurts. Now we know the latest research shows that that's not true. Well, some of that is true, but it's not the reason why people get fibromyalgia. Our fibromyalgic patients are what we call wind-up patients. And in order to understand that, you have to understand this. The human body is a perfect machine. You send it, pain is coming up to the brain from the periphery, where the pain is going to be processed and interpreted. But the brain also tries to dampen the pain. So pain is coming up to be sensed, but at the spinal cord level and at the coronal level, at the brain level, the brain sends down to the spinal cord two substances, norepinephrine and serotonin, and that dampens the amount of pain coming up. So we usually say that in order to perceive pain, there is an ascending limb and there is a descending limb that blocks some of the pain from reaching up. And typical example, if you're in a war and someone shoots you and they injure your arm, but your life is more important at that moment, you have no pain. Well, the descending limb blocks you from feeling pain. Another example that I recall is there's a father driving into Las Vegas. He and his kid get into a major car accident. The kid is badly injured. They cannot drive the car. The father takes the kid and literally walks into a hospital. Only when he deposits the kid in the doctor's hand, though, he realizes that he's walking on broken legs, he had no pain. Well, the descending limb is what's blocking that individual from having pain. That extends now to fibromyalgia. What we believe now is that patients that have fibromyalgic pain, they have a defect, a dysfunction of that descending limb to block the pain from coming up. So those patients, normally, if they have pain coming up, it's a balance. Pain comes up, the brain tends to dampen some of it, so not the entire impulse reaches. Whereas patients with fibromyalgia, everything reaches the brain. And therefore, when that happens, they are more sensitive to pain. So they have what we call a defect in the descending limb, in the modulatory limb of the body. That is why patients with fibromyalgia, you try to treat them with amitriptyline, Cymbalta, because those are medicine that releases norepinephrine and serotonin in your brain, and you're forcing the brain to recreate that downward suppression of pain. Once you have that, and patients with fibromyalgia usually develops after trauma, as you know. Once you have fibromyalgia, and if you get RSD, now you have the double whammy, because now you have the RSD pain coming up, fibromyalgic patient that already has, in theory, this defect. Well, now we're in trouble because there is nothing damping the pain. So it's this continuous bombardment of pain to the brain without anything telling the brain to, or the brain telling the receptors, calm down, settle down. And that creates the problem. With
just from a physiological standpoint, somebody with fibromyalgia is likely to suffer more in the event of trauma than somebody who does not carry that diagnosis.
They are prone to experience more pain. Right. Not so for more trauma, because trauma is supposed to what you're doing. But when someone with fibromyalgic experience any type of trauma, they are wind up, so they will experience more pain. And if you receive a patient that has classic fibromyalgia, now this diagnosis right now is overdiagnosed. Every human being now has fibromyalgic pain. Sometimes they come here and I'm like, oh, I'm supposed to be an expert in it, I don't even know what you have. Because fibromyalgia is a very specific diagnosis, but a lot of times patients go to the doctor, they don't want to deal with it, or they just don't know, you have fibromyalgia, just to get you out of the room. And once you tell a patient you have fibromyalgia, it's almost bad. Because the minute that all the doctors hear that, we immediately tend to pull back. Oh, that's a fibromyalgic patient, you cannot do anything. So I tell any patient that has fibromyalgia as a diagnosis, make sure that that's correct, because it affects you with additional care. It affects whether or not a doctor will go further trying to diagnose other problems. Because if he labels you as a fibromyalgic patient, he will give up. Because he will say, well, there's nothing I can do. Here is Cymbalta or Lyrica, any of those things. So it does matter. When they do have classic fibromyalgia, and I'm telling you in my practice, I'll probably have 5 or 6 patients, I can name them with my hand, that have classic fibromyalgia. The other ones, you usually can find a cause for their pain. Usually they have arthritis, they have some other disease process. But those that have classic, they are prone to more pain. They wind up. If they have RSD or complex, they will be the worst side of the curve than on the left.
Thank you, doctor.
You're welcome.
Suffering from pain? Come find relief at Hyde Park Pain Management. Patients from all over Boston and the New England area come to our state-of-the-art medical facility to be treated by our world-class physicians. Each one is board certified in pain management with extensive experience treating a wide variety of conditions, including back pain, joint pain, arthritis, migraines, sports injuries, work-related injuries, and motor vehicle accidents. We offer flexible appointment availability, acceptance of most major insurance plans, easy access to public transportation, and free parking for our patients. Plus, our expert physicians speak several languages, including Spanish, French, Russian, Ukrainian, and Arabic, to even better serve patients with English as a second language. To learn how we can help you manage your pain, visit our website or call 617-833-6100 today. Hyde Park Pain Management. Relief is here.